Good morning, my name is Joelle and I work at the Swedish Cancer Institute. I'm a certified tobacco treatment specialist and I work as a nurse practitioner in our tobacco-related diseases and lung cancer screening program. Every day I help people quit smoking, and this video is intended to help you learn how you can quit smoking successfully and confidently. Before we get started, I just want to mention a couple of disclosures. One is that I mention a lot of products in this video, and I want you to know that I do not have any financial interest in these products that are described in the lecture, and I am not a representative of any of the companies who manufacture the products that are discussed in this lecture. Now, I think of treatment as the difference between a crash landing and a smooth landing. Many people try to go it alone. Many people attempt to quit by going cold turkey, or they try different modalities, but they haven't really had the benefit of knowing what is the best way to approach this. And trying to come off the cigarettes can be a really rocky landing. With treatment and a strategic plan in place, quitting smoking can be like bringing a plane in for a smooth landing. Now, there's a number of options, and we're going to talk about that now. Nicotine replacement therapy has been around for decades. Most people know about it, but there are a few specific pieces of information I'm going to give you today that I hope will be helpful to you, because many of these are options over the counter. There's nicotine replacement therapy, there are a couple of prescription medications, and there are non-prescriptive and non-pharmacologic approaches as well, and we'll talk about that. So let's first talk about the long-acting transdermal patch. The long-acting transdermal patch is exactly that, long-acting. The whole idea behind this medication is that you put it on your skin and it delivers a steady state of nicotine replacement therapy for a long duration of time. Typically, they're 24-hour patches. So from the time you put the patch on, the nicotine level rises and it maintains a steady state until 2 or 3 hours before it's time to change the patch again. Now, the patch comes in 3 different doses. We're going to talk about how to dose it, but it comes in 21 milligrams, 14 milligrams, and 7 milligram doses. Now, 1 cigarette equals approximately 1 milligram of nicotine. So if you're smoking a pack of cigarettes a day, you want to reach for the 21 milligram patch. It's very important to dose the nicotine patch according to how much you're smoking, just to be sure that you're getting enough nicotine replacement similar to if you were smoking. If we don't replace the nicotine via the patch at an accurate, or at least close to an accurate dose of what you're accustomed to, you'll experience withdrawal symptoms and you'll be at risk for relapsing. Now, if you smoke closer to 3/4 of a pack a day, you would want to dose it at 14 milligrams. And if you're at about a half a pack or less, then you'd want to reach for the 7 milligram patch. Now, you may remember earlier in the slide deck, I showed you that when you have a cigarette, the nicotine goes into the bloodstream very rapidly, and you get a big concentration of nicotine replacement to the brain from smoking a cigarette. Now, when we're replacing nicotine via a patch or by mouth that is a non-cigarette, you will not get the same quick kapow to the brain. And you need to have a realistic understanding of that so that you're not expecting the same type of response when you use some of the nicotine replacement therapy when you're treating yourself to prevent with relapse. So when you utilize the nicotine patch, you most definitely won't experience that. It's a slow ramping up of the medication and a steady state, but you will not feel a surge in your brain like you do when you have a cigarette. Same with some of the short-acting nicotine replacement therapy methods, what we're going to talk about now. When you use these options, it takes about 7 to 10 minutes to get to your brain versus 7 seconds. So understanding how they work and having a strategic plan is very helpful so that you can prevent breakthrough urges. Now, short-acting nicotine replacement therapy is a quicker acting compared to the patch. The patch goes in, it maintains a steady state over a long period of time, and then it slowly digresses in dose delivery, and that's right when you're getting ready to put another patch on. The short-acting nicotine replacement therapy comes in 4 modalities. But the whole idea is that these when you're having an urge to have a cigarette. So therefore, those breakthrough periods of time, even though the patch is on your arm and you're getting nicotine replacement therapy, you can still have some breakthrough urges to have a cigarette, and you want to plan for those and be prepared. Now, the gum and the lozenges come, you can purchase them over the counter. They come in 2 and 4 milligram doses. And again, it's important to choose the right dose for you. If you smoke 1 pack a day or less, the most appropriate dose of gum or lozenge for those breakthrough urges to have a cigarette is the 2 milligram dose. If you're smoking greater than a pack a day, then purchase the 4 milligram pieces of lozenge or gum. Now, the gum can be a little high maintenance. It's not for everyone, but often people will come to me and say, that gum, it doesn't work. And it's often because they're not experiencing benefit from it because they didn't get to use it the appropriate way and they didn't know how. The gum is very specifically intended to be chewed until you feel a zingy flavor in your mouth. Some people say it's even peppery. And as soon as you experience that in your mouth, you need to park it between your cheek and your gum. When it's parked between the cheek and the gum, then you're getting your nicotine delivery. You don't want to swallow the nicotine. It often will cause nausea, turn your stomach upside down, but more importantly, you will not absorb the nicotine. Nicotine does not absorb in an acidic environment, and your guts are full of acid. So when you chew the gum, you chew and park it for 5 minutes, then you chew it again until you experience that zingy flavor, and then you want to park it again for another 5 minutes. And you rotate that for about 30 minutes, and then you spit the gum out. Now, the lozenge comes in 2 different sizes. So it comes in 2 different doses, and it comes in 2 different sizes. It comes in sort of a round wafer that's a little smaller than a Tums, and it comes in a little mini lozenge that's a little bigger than a Tic Tac. And again, you want to tuck it between your gum and your cheek to optimize the delivery of the nicotine replacement. Now, you want to use these medications when you're having an urge to smoke. You can use it on an as-needed basis, but you can also use these on a planned basis. If you know you're going to get yourself into a situation that would typically trigger having a cigarette and it's going to make it difficult, then plan ahead and chew a piece of gum or get a lozenge in your mouth before you land into a situation that you know may be a big high-risk setting, especially if it's a social setting where you may encounter smokers or some of the more germane activities in your life that often trigger having a cigarette. That could be getting in the car to drive to the grocery store. For some people, it's taking a walk with their dogs and they love to have a cigarette. But plan ahead. Always have your nicotine replacement therapy with you. So when you want to use the lozenge, you just park it in your mouth and you let it dissolve. You don't have to chew it. Just park it, let it dissolve. When you have the gum or the lozenge in your mouth, we would recommend that you only drink water if you need to drink something until you're done with the dose, and then you can drink anything you want to. Now, nicotine replacement therapy also comes by prescription. There's a Nicotrol inhaler, and the Nicotrol inhaler is an apparatus that is about this long. It's plastic. It has little cartridges that have about 80 puffs of nicotine in them. And you get them from the pharmacy. They're prescribed by your medical provider. And you can put the cartridge into the apparatus and twist it. And then when you're ready to use it for breakthrough urges to have a cigarette, you just puff on it, but you don't want to take a deep inhalation like you're having a cigarette. You want to just puff on it and suck it into your mouth because, again, the nicotine replacement therapy is being absorbed into the mucosal tissue of your mouth. The nasal spray is very similar in its absorption, but it's in the nose. And instead of pointing it up towards your sinuses, you want to point it towards the septal wall of your nose, and that's where the medication is absorbed. Now, the nasal spray is the most effective in delivery. It absorbs a bit quicker than the gum, the lozenge, and the Nicotrol inhaler. You also need a prescription for the nasal spray by a medical provider. So this is just a reminder, the gum, the lozenge, the oral inhaler, and the nasal spray are all absorbed in the mucosal tissue of either your mouth or your nose. When you're utilizing the agents for your mouth, avoid carbonated beverages, fruit juices, tea, coffee. All of those are potentially acidic and will neutralize the effects of the nicotine replacement therapy. A lot of people ask me what the cost of these agents are, and so I did a price check at about 6 different places, and that included Costco, Sam's Club, Walgreens, Fred Meyer, and I've listed a range of prices based on these various stores. Now, I'm not going to tell you which stores were more expensive, but I will tell you that if you're interested in utilizing these agents, I would encourage you to go do some price checking to see what you can get. Some are definitely cheaper than others. Cigarettes, at least in the state of Washington, cost around $8.50 to $10 per pack. And on a 30-day cycle, that's, or 30-day month, that comes out to about $300. A nicotine patch, the cheapest I could find, came in at $2.50, and the most expensive was at $3.40. That's what they averaged in a packet of 7. And nicotine lozenge and gum, I averaged for 10 pieces a day at 30 cents a piece, and 10 pieces would be very, very generous. Most people, if their patch is dosed correctly, only require somewhere around 5 pieces of gum or lozenge a day, and many people are even less than that. But I was generous in my estimate, and that came out to $3 a day at 30 cents a piece, and that equals about $90 a month. Now, the cost savings while on treatment, the treatment is recommended for a minimum of 12 weeks. And if you look at the total monthly savings between smoking and utilizing the patch plus the gum or lozenge, it came out to about $108 savings in each month in the first 3 months. And that was a total savings of $324. Now, after you get past the 3 months treatment period and you're not purchasing the nicotine replacement therapy or the cigarettes, there's a more substantial savings of $3,000 in that following 9 months for an annual $3,324 savings in that first year when you quit smoking. I always encourage people to consider making a plan to reward themselves when they are quitting smoking. It's sort of an incentive, thinking about your motivations, changing up your lifestyle a little bit so that you are creating some new habits and rituals in your life to support your new lifestyle without cigarettes, and also just even perhaps considering tucking that money away, the savings from not purchasing the cigarettes, and reward yourself at intervals of time or after that first year of being successful staying quit off the cigarettes. Now, a lot of people are very interested in e-cigarettes. For some people, this is becoming a fad. E-cigarettes have a strong presence in our community now, especially amongst the younger populations in our community. And I just want to make it clear that the e-cigarette is different than the Nicotrol inhaler that I previously described. The Nicotrol inhaler is the prescription nicotine replacement therapy that has a little cartridge with nicotine in it. That is not an e-cigarette. That is purely nicotine, and it is considered nicotine replacement therapy. Now, e-cigarettes are manufactured by various folks, including the tobacco companies, and the contents of those e-cigarettes are not well known at this time because they're not regulated by the FDA. The e-cigarettes are, many people think, are a lot safer than smoking cigarettes because it's a vapor. Some people call it vaping to use the e-cigarettes. But it's a battery-operated apparatus, and it has these little fluid-filled cartridges that have polyethyl glycol. When you inhale off of it, you get a dose of nicotine, what other chemicals are in that, and you inhale the polyethyl glycol, which our feeling is that it may not be necessarily safe. But one of the other hazards of utilizing the e-cigarettes is that, again, you're inhaling the nicotine and it's going straight to your brain. And it is definitely carrying the nicotine dependence. And so for people who are really interested in getting past their nicotine dependence and getting off all substances, e-cigarettes could make it very difficult to do that. So e-cigarettes are not a regulated product. The safety is not well established, and no recommendations for use of that product can be recommended at this time. So let's talk a little bit about prescription medications. Most people have heard that there are tablets that you can take to help you quit smoking. The first medicine that we're going to talk about that requires a prescription for your medical provider is called Wellbutrin. It actually goes by several names: bupropion, Zyban, Wellbutrin. They're all the same medication, and they all work exactly in the same mechanism. Now, this medication has been around for many decades. It's traditionally noted to be an antidepressant, and it does work at higher doses as an antidepressant. But the way it works as an antidepressant is to drive the exact same neurohormones that you get a surge of when you have a cigarette. And so the Wellbutrin drives the dopamine and the serotonin and norepinephrine up. It helps cut the crave and the urge to have a cigarette, and it maintains a sense of well-being when you're trying to get off the cigarettes. Now, it drives the dopamine levels through a different mechanism than the Chantix, and we're going to talk about the Chantix in a moment. The nicotine replacement therapy and any of these pharmacologic agents are not intended to be long-term medications. Typically, people are off their full regimen within about 12 to 16 weeks. And so I like to frame the use of medications within that so that you understand that it's not something that you are going to have to be on long term. The patch, the gum, the lozenge, these are all items that we would slowly wean you off of over the course of 12 weeks. And you would be on your way without any reliance on any of these medications. Now, some people do continue to utilize medications like Wellbutrin because they feel like it really helps prevent relapse down the road, and that's a decision that you can make with your medical provider. But it's just good for you to know that it's an option. Now, a lot of people are interested in side effects of these medications. So let's talk about side effects to Wellbutrin. I've been prescribing these medications for about 15 years, and I would say that the most prominent side effects to the Wellbutrin can be nausea, especially if people don't take it with food. It can be more activating than sedating, so it's often a medication you want to take in the morning versus nighttime. And it drives the dopamine levels up. Now, I find for smokers who they're already acclimated to the dopamine levels in their brains, they tend to tolerate loading up on this medication very nicely. And in my practice, I use lower doses of this medication. It's uncommon, it would be rare to require really high levels of this medication in more of the depression dosing range. Usually it is coupled with nicotine replacement therapy, and it's a very low dose, long-acting delivery. Now, the varenicline, also known as Chantix, is a medication that's gotten a lot of attention. You may know that early in its career, it was labeled with a black box label warning for concerns about suicidal ideation. And I think it's really important to just call that out right away. This medication is not for everyone. Neither is the Zyban Wellbutrin. The ticket is to really understand what these medications are, how they work, and then develop a personalized plan for yourself and with your medical provider to be successful in quitting smoking. Now, the varenicline is a very clever medication. The way it works is that you take it by mouth. It's a standard dosing for everyone, 1 milligram twice a day. But when you take the medication, it goes into your bloodstream, it goes to your brain, and it attaches to the exact same receptors that the nicotine, when you inhale it, attaches to. It attaches to the nicotinic acetylcholine receptors. And when it attaches, it creates that same lock and key mechanism and allows dopamine and norepinephrine and serotonin, the neurohormones that make your rewards center feel good and your body feel good, occur. So it really mimics having a cigarette. In fact, the Chantix is a bit more potent at attaching to those nicotinic receptors than cigarettes are. And so if you're on the Chantix, it's not really intended to be utilized with the nicotine replacement therapy. And that's because they would both be competing for the same receptor. And Chantix is going to win out because it has a stronger polarity for those receptors. So it's really not necessary to utilize nicotine replacement therapy when you're going to be on that varenicline, also known as Chantix. Now, the most common side effect that I've seen as a prescriber is nausea. And if people take it with a solid meal and a full glass of water, you can usually mitigate that symptom. People need to have a conversation with their medical provider. Not everybody are candidates for both or either of these medications, but if you take a look at the studies, people are much more successful with nicotine replacement therapy, counseling, and or pharmacologic agents like Wellbutrin and varenicline than not. And so if you're really sure that you want to quit smoking and moving forward with that commitment, considering all of your options is important. I do want you to know that even if people have side effects to these medications, they often adjust. And if they're a side effect that you're not tolerating, those side effects go away as soon as you stop the medication. Now, there's counseling and internet options. If you take a look at the studies, we know that counseling alone does not provide a really high chance of quitting smoking. It's ideally in combination with the nicotine replacement therapy and or the other pharmacologic agents we discussed. But counseling is a really important element of quitting smoking, and it can be very helpful for anyone who has smoked cigarettes or counseled someone who's been trying to quit smoking. You know that there can be good days and bad days. And so having support can be very, very critical in that long-term quit attempt. Now, in every state, there's a 1-800-QUIT-NOW number. You can dial it, and there are different resources available, and that's dependent on funding state by state. Some states are actually able to send out medication for free, primarily the nicotine replacement therapy. So it may be worth it to reach out to your local 1-800-QUIT-NOW number. And they usually have resources available where people will trained professionals will continue to follow you over a duration of time to help you quit smoking. I've listed a couple different internet options as well. The American Lung Association has a Freedom from Smoking program. The U.S. Department of Health and Human Services has smokefree.gov. One of my favorites is the becomeanx.org. They're a great organization online that can be very helpful in providing resources and online support, and Healthways as well, quitnet.com. So as I mentioned, treatment really does work. To learn more about quitting smoking, you can visit our website at www.swedish.org/quitsmoking. Thank you very much and good luck.